So welcome everyone to the Children's Mental Health Matters webinar series. I'm Angie McRae. I'm the Child and Family Engagement Manager here at the Mental Health Association of Maryland. Today's session is being recorded and will be made available for viewing later this week or early next week. Today's presentation is titled Stages of Change, brought to you by Alex Chen from the University of Maryland Extension. In this session, you will understand the burden of change, understand how behavior change happens. We'll discuss how harm reduction strategies keep people safe, build self-efficacy, and support behavior change, and learn how to implement effective strategies to support people through the process of change. Alex Chan is the mental health specialist for the University of Maryland Extension. His recent extension programs have focused on overdose response, mental health of farmers, and community capacity building through programs like mental health first aid. He holds master's and doctoral degrees in human development and family studies from Auburn University. Alex is also a licensed marriage and family therapist. He continues to practice marriage and family therapy with the Sibley Group, DC, outside of his work with the University of Maryland Extension. So welcome, Alex. I'll turn it over to you now.
All right, thanks, Angie. And I'm happy to be here to share the materials today. This is one of my favorite presentations to give because I think whether or not we're directly involved in helping someone else engage with new behaviors, I think this material is also personally helpful when you think about making changes in your own life. So glad to be here. This is a presentation that I was trained to give by the Maryland Department of Health, hence the logo there. And they are also asking that I share a brief pre-test and post-test with you all because they want to collect data on how the programs impact people's perceptions. So you can use your phone to log in and answer a few questions there. I'll just leave that up for a couple seconds. All right. This presentation is part of a whole series called Regrounding Our Response. And the series is designed to equip people with the knowledge about the most effective, well, not just strategies for addressing the overdose crisis, but how did we get here? How to understand the development of things like addiction in our communities? What has been done already to try to assess this or address this problem? And what is and is not working about how we're addressing this problem. And so all of these presentations do discuss things such as harm reduction and that's infused throughout. So whether the topic is today the stages of change or whether we're talking about ACEs or medications for overdose prevention, there's always a harm reduction component. So we'll talk more about that later, but I did want to point out that there are several other presentations in this series that I am also able to offer if anyone in this room is interested in inviting me or my team out for other presentations. I'm not the only one. All right, so these were the objectives that Angie shared on the front end. We're going to go spend some time with each one, and hopefully you all will walk away especially with some of those strategies on how to engage with others at different stages of change. So I want to begin actually with just a informal poll here. If anyone wants to share, you could feel free to chat or unmute. What do you already know about the stages of change? And what are you hoping to learn? So you could share your thoughts on either of those questions. What do you already know about stages of change? And what are you hoping to take away from today? Love to hear some initial thoughts. To the extent that I know what people are looking for, I can try to weave in some extra content or interpret it in a particular way. Anyone familiar with these terms already? Or have a particular objective that they're hoping to achieve today?
Hi, thanks for doing this today. I've studied this over the years, so I'm pretty familiar with it. And then today, I just always love to get new insight and um, continue learning and how we can communicate with our loved ones who are struggling. So really
Great.
appreciate this. Thank you.
Thanks for sharing. Yep. So even if you may be familiar, I think perhaps the connection to public services delivery may be different for some folks because that's a unique element to this. We're not just going to be talking about the stages themselves. We're going to be talking about how they map on to public services as well. So, or I guess not, healthcare services in general. So that may be a component that is new to folks. All right, and I like to see how these stages can be applied to different aspects of our life. Yeah, I'll try to pull in a variety of examples. Although the theme is related to addiction, I will definitely draw upon other examples. So let's get right into it. We're going to start by understanding the burden of change. Why is change hard? So I want you all to think about the last time you tried to make a change in your own behavior. And what challenges did you face? This is another one where I'm asking for you all to take a risk and share a little bit. I can share a little bit for myself. So, one, it doesn't have to be related to addiction, of course. It can be related to any behavior change that you tried to make. I know for me, one of my biggest challenges, which I think many people may share, is getting to the gym more, being more active. And I think that the biggest challenges that I faced before this year was the sense of like dealing with the sense of like sacrifice of like time is limited and what am I giving up in order to um, go to the gym and get more time there. And that idea of the gym as sacrifice was a big challenge for me. It just felt like a negative. And so it really held me back for a while. So that's my example. Also, my schedule tends to be highly variable, and so it was hard to find a time that worked to go consistently. What about others? Last time you tried to make a change, what challenges did you face?
Well, I'll just share that I think sometimes it's just old habits are hard to break, right? Like we have
Oh,
patterns of behavior, and even though we intend to change them, those things come are sometimes so ingrained in us that it's just difficult to make those changes. So,
yes, that is so important to acknowledge. And I'm actually going to drop a link in the chat for another program that we do, which is called the Habit Shift Mindset, where we talk about one of the best strategies for behavior change personally, not necessarily when you're helping others, but personally, is to actually analyze the current habit. Because a lot of people just jump straight to what they want differently, but they don't understand why they're doing things the way they are right now. And so that can be a hurdle. Anyone else want to share?
I will share one of the th things that I have been working to change is in my diet, like a lot of people, and um, my partner is not on board with it. So
Yes.
So that's challenging when I'm also up against the presentation of the foods that I might not, that I'm trying to eliminate are in front of me. So it really helps with my empathy for someone struggling with substance use and
Yeah.
not having that in front of them just doesn't help support the change.
Yes. Yes. Yeah, your community and your environment definitely impact the ability to, or the ease of making changes. So here's a list that I want to share on 8 reasons why change is tough. I'm not going to go through each one in great detail, but I will start with the first one. So negative emotional motivation, it's understandable to think that things like guilt or fear should be enough to, get you to change. It's like you go to the doctor and they kind of put some fear in you about like, oh, you're overweight, or oh, what's going on, your numbers are off. So it's how a lot of our systems are structured already, are fear-based or guilt-based. However, those things don't create lasting change. The opposite is true. Negative emotion is horrible fuel for making changes that stick, right? So using our gym example, you may feel guilty enough to go to the gym once, but then once you do that, you're going to have to wait days, weeks, or maybe even months before enough guilt reaccumulates for you to go again, right? So that's not going to create lasting change. That may create sporadic engagements with change based on a high presence of that negative emotion. And so who wants to carry around enough negative motivation to do these changes every day? Like that, then you'd just be miserable all the time. So it doesn't really work for lasting change. Real change needs a positive platform to launch from. And so in my example, I was so focused on what I had to give up to go to the gym that's what I was rehearsing in my head. It was just like, I don't want to give up this time or that thing or this event or time spent with family or friends, So focusing on negative emotion and trying to use that as a catalyst for change is not going to work. There was a review of over 100 behavior change studies, which found that the consistently least effective strategies hinged on fear and regret. So I'll jump over to number 3, actually. So we try to all or nothing thinking. Maybe you've heard the phrase, we try to eat the whole elephant at once. Behavior change is a big thing, no matter what the behavior. And it's almost never possible to take it all on at once. You need to start somewhere, though, and with our SMART goals, right? That's why we hear about that framework all the time. Particular measurable actions. Big and vague goals generally won't get us very far, or they'll lead to a sense of confusion or regret that we're not making those big goals. So rather than thinking, I got to do all this at once, like I'm going to go from 0 days at the gym to I'm going to go 3 times a week now. Whoa, that's a big change. And actually, in my gym journey, I went from like 0 to in like 2023 or 4 to 1 day a week in 2025, and now my goal this year was 2 days a week. So it's like I'm taking whole years to add on, a couple hours of activity, and so it's just because I've accepted that it's too much to try to jump to like the optimal all at once. But that is a common fallacy that people encounter, is that I just got to go all in all at once. We often neglect the toolbox. So if you want to fix your car, you need the right tools. And we actually know from decades of psychological and behavioral research, like what does help sustain change, and which is what I'm going to be describing in the rest of our presentation. And so we need to make sure that we're following the processes that we actually know work. Depending on what your change goals are, that may involve certain skills, right? Like, so if you, leaning on the gym example again, if you want to go, but you don't know how to use like the weights or the machines or what to do, you need to learn that. And so that becomes its own goal instead of just like, oh, I need to go X number of times a week. Maybe your first goal is I need to learn how to do what I'm going to do. So I'm going to jump down to number 7. We forget failure is a given. Trying to make change and failing is one of the sturdiest truths of behavior change. Failing at least once is part of the process, and it's probably going to be more than once. So what people can reframe for themselves about bumps in the road is that it just reveals what needs more attention. Every failure highlights, okay, this part of my plan didn't work. And so it's just information about what needs to happen next. And then this last one, I don't know if we have any people that are in helping professions. At the very least, we may know somebody who in our family has leaned on us for help, or we want to help in some way. No commitment to change. Just because somebody is talking about change doesn't mean that they actually are ready for it or want to change. And that is a really hard lesson to learn, that we may be so relieved to hear somebody, for example, let's go to addiction, like let's hear somebody say, yeah, I know my drinking's a problem, or I know, I've, that this, using, pain pills, opioids, whatever is going to lead me down, or, I know where this goes. Them saying that does not mean they're ready to change. And so if you get too excited as the helper and start jumping in with all these plans and resources and treatment, you may actually turn the person off because they weren't there yet. They were just talking about it. And there actually was not a commitment. So part of what I'll be talking about today is how do we actually assess whether there is a commitment to change or not? Because no matter who we're helping, what the problem is, we need to actually know that we have a customer for change. That is a phrase that one of my graduate school professors used all the time. Are they a customer for change, or are they just here kind of doing a pro-con list in front of you? So we need to know what's going on. So let's still focus a little more on how this applies to drug use. There was a study done. This is the results from a study from 147 patients in different community health centers who misused drugs but did not meet the criteria for substance use disorder. And they were surveyed to identify why weren't they actually seeking treatment yet. So this is a subclinical group, meaning they're not quite at the criteria, but they had some kind of issue with substances. And they said, number one issue was that they needed drugs to alleviate mental or emotional distress. The environment, as some of you mentioned, proximity to places or people associated with drug use made it difficult to change. And then a lot of people, when they're in the throes of addiction, they really do believe that drug use enhances their quality of life. And so, although you may see many other collateral damage effects of drug use, the person themselves is thinking, I like myself better when I'm using drugs. And so this is a common reason why people are not ready for change. And then habits. Yes, sometimes habits are just difficult. I want to show one more that's similar. So this was from the 2021 National Survey on Drug Use and Health. And I think they might have the 2023 results available now or soon, but this is pretty recent. And so this is among adults 18 and over who felt they needed treatment but did not get it. And again, they're just saying, I'm not ready. I don't know how to afford it, or healthcare insurance is giving me issues. Don't know where to go. A surprising 1 in 5 people saying they don't know where to go. That's pretty bad. And then some worries about stigma. So how does this relate to, what we think about behavior change? Well, the criteria for actually having a substance use disorder, if you look at this list, taking more than you're meant to, wanting to stop but can't, not managing what you should do, continuing to use even when it causes problems in relationships, giving up things, spending more and more time searching for the substance. A lot of people associate having a substance use disorder with these words tolerance and withdrawal, like, oh, you're building up a tolerance, you need more and more. And they view it as purely like physical, which it is a disease of the brain. Like your brain does change in response to addiction. But actually, 9 out of 11 criteria relate to not responding to negative consequences. So this is really important. It's diagnosed as a disorder because people are not responding to negative consequences. So this loops us back to, we cannot scare or guilt people who are dealing with substance use into change. The very definition of the disorder is that they're not responding to the negative consequences. So that is really important for us when we think about helping others. It's also really important when we think about policy decisions. Fortunately, Maryland has some pretty progressive policy regarding how we address people who are battling substance use disorders. It's not evenly applied county to county, though. So different services, even though they may be legal or available or encouraged at the state level, certain things aren't available county to county. And we'll talk more about that later. So you can't guilt people or scare people into change. We got to be, patient and aware of what people are actually open to. And we need to understand that recovery from substance use or opioid disorders requires an intentional change process, which is a very personal choice. You're not going to be the one to you can't make somebody want something that you want. It has to be their desire. And there's many factors that are involved, but it does follow a common path, and that's what we're going to describe now. Okay, so how does behavior change actually happen? We're going to do a fake news headline first. So imagine that this headline popped up on your phone and it was real. Imagine this was real. In a large study, researchers at the National Cancer Institute discovered that watching TV more than 1 to 2 hours a week causes brain cancer. How many of you would stop watching TV immediately? Now, I can't see your faces or hands or whatever, most of you, but when I do this in a physical face-to-face setting, I would say maybe a quarter of people raise their hand on average. And then a quarter of people have a response along the lines of like, I don't believe it. I want to see the data, show me your methods. And then, another group of people says something along the lines of, well, I've already been watching TV my whole life. And so I definitely have brain cancer and no sense in giving up now. But think about how that maps on to other health issues, right? Our theme today is addiction. People use that same rationale when thinking about changing other health behaviors. They either think I'm a lost cause. They think, how can I replace this? Like with TV, it's like, oh, so many of us rely on TV to like decompress and chill out at the end of the day. How am I gonna get my chill time without TV? How am I going to keep the kids entertained while I'm cooking dinner? There's all these things that get in the way, and the same stuff gets in the way of interrupting drug use. The same stuff gets in the way of introducing new health behaviors of a variety of kinds of health behaviors. So this is just, examine your own reaction here. Depending on what reaction you had, this is the same reaction that many other people will have to their considerations of change. So, but one thing that we need to shift One thing I'm big about is trying to reduce, stigmatizing or blaming language. That is really, again, that's fear and shame, right? We can't fear and shame people into change. So we need to try to find better language. One of the things that we can start to say about people is that they're not like lazy or unmotivated for change. Instead, they're either motivated to engage in behaviors that are problematic, or they're not ready, probably and not ready to begin behaviors that may be helpful. And what we don't understand, which was, Marcy's point from earlier, is why are they motivated to engage in those problematic behaviors? We need to understand the current cycle before we help people try to introduce something new. So both of these are important. If we're frustrated with somebody that they're not changing, rather than just judging them and saying, oh, well, they're just an addict, they're never going to change. We need to use more accurate language, which is, I don't really understand, what they're getting out of this right now. I don't really understand how they're calculating the benefits and drawbacks. And, or maybe they're just not ready. Maybe they don't feel, for all the reasons in the studies that I shared, maybe they don't feel that change is accessible to them right now. And so rather than blaming them for not seeing the potential for change, maybe I need to ask and show curiosity rather than judgment about, why is this hard for you right now? So this is sort of an informal way of talking about the stages of change. So this is sort of the process. People will only change when they become interested or concerned about the problem. So that's like the first two stages. They become convinced that change is in their best interest, because some people decide, yep, I've been watching TV forever. I know it's a problem. I know it's bad for my health. I agree it's a problem. I'm not like in denial or anything, but I'm just not willing to change. Some people make that choice. Think about smoking. Everyone knows not good for your health. And some people, especially as you get older, they're like, been doing it my whole life. I know it's bad for me. I know I'm feeling the effects, but I'm just not willing to do it. So they have to be convinced that change is in their best interest, more than the costs of ending whatever the old behavior was. You need a plan, you need to commit to the plan, and then finally take the actions. Notice, actions is the last step. Here's another visual for it. Someone's readiness for change is a product of their willingness and their ability. I think that this is a really easy way to explain change to other people who maybe not, like, depending on what professions you all are in, maybe you're in this human sciences realm, but other people, you're talking to an engineer or a computer scientist or something, who's not in our field, saying, hey, this is what really makes somebody ready for change. And so either the person in front of us, if we're countering resistance, either they're not willing or they don't feel that they're able to do something. Both can be influenced by the helper. You can influence somebody's willingness. You can influence somebody's ability. But you have to know where the deficit is. We also need to expand the list here. So sorry for bouncing around. Take a look at willingness. How do you influence somebody's willingness? Well, you need to offer a sufficient menu of options for somebody. It used to be that, in terms of drug use, the only approach, especially the only approach that was like sanctioned by authorities, was like cessation. Just don't do it. Whereas actually, okay, yes, ultimately we would like people to not use, opioids and things that are not prescribed to them and all that. We would like people to cease. However, behavior change includes so many other things. Cessation is not the only type of behavior change. We have initiation of things that are supportive of your health. You can start going to the gym, you can start to use condoms, you can start to carry naloxone, start using PrEP. You can change, your situation. So, okay, eating, you're not going to stop eating, but maybe you limit calories, reduce alcohol, using sterile syringes. So all of these things count as behavior change. So somebody, when they're early in the change process, maybe they're not feeling very ready because they haven't, they don't think that they're able to make a certain change. But that's because they're focused on like total cessation. When you talk to somebody and say, hey, you know, there's a variety of ways that you can support your health insofar as it relates to this issue, that might actually increase their willingness, and let them know that, you know, that you can learn new abilities, you know, along the way to eventually get you towards cessation of things that are unhealthy. All right. So kind of underscoring the point I just made there, major behavior changes don't happen overnight. This is something that we all, as people wanting to make changes for ourselves and as helpers, we have to be patient. The process of change is predictable. You go through certain stages, and several of them happen before somebody takes any new actions. So let's go ahead and share what those stages are. This is the stages of change model that I heard some of you are already familiar with. We'll go through these in more detail later. But you start off not thinking about changing, then you start thinking about it during contemplation. Once you've decided that you do want to make a change, you come up with plans, test those plans, and then finally those actions become habits over time. Notice again, doing anything is the fourth thing. And these first 3 steps may take years. Think about my example of, you know, yes, I think my goal is something like 3 times a week in the gym. I've already spent 2 years sort of between these stages. And that's, you know, me living a relatively uncomplicated life. You know, so imagine when people with a highly complicated life are trying to make changes. One thing to not forget, studies show that people progress and recycle through the stages on their way to achieving long-term behavior change. So you may start talking to somebody, the plans seem really scary to them, so they go back to contemplation. Or you may have come up with a plan, they start trying something new, they feel a sense of failure, and they go back to contemplation. So this is common. Sometimes people may have such a bad experience that they go back to not thinking about change. So there are key tasks in each stage, and in a little bit I'll go through what that looks like, but I'll just show that here. You know, when somebody's not interested, you're doing what limited actions you can and very gently trying to increase their interest and concern. When someone's thinking about it, you're helping them with the risk reward, you're not pushing. When someone has decided that they want to make a change, then you help them come up with a plan, test the plan, and then finally help them make it a habit. One thing also to realize is that health behaviors are complicated. Changing one thing may involve changing a bunch of other things too. So for example, if you want to stop using heroin and, you know, all your friends use heroin and it's your primary coping strategy, and, you know, there's all these things associated with it, you know, and other health risks, there's going to be a lot of target behaviors. And each target behavior has its own change process. So just because you're working on quitting heroin does not mean that you're ready to do a bunch of other stuff. Yes, broad change goals involves the process of changing multiple behaviors, right? So in my, you know, simple gym example, okay, I had to change not only my schedule a little bit, but I had to change my thinking about not giving something up. I'm working towards something that I value. I had to change my identity of like, I am somebody who goes to the gym. I remember always telling the story to people of like, I hate going to the gym. I hate lifting weights. And I had to be like, you need to stop saying that. Because the more I say that, the more I believe it. And that only happened sometime in the past, like after I started going. And so I was like, okay, I need to just stop saying that. I need to say that I'm just like working on my health, and have that be more of the story than like, oh, I'm doing it, but I hate it. That's not going to help me sustain things. So here's an imaginary picture of somebody, they're a multi-substance user, polysubstance user. So they use cigarettes, they use heroin, and they drink. And here's their stages of change on all those different things. So they're thinking about quitting cigarettes. They already do carry Narcan. They have for a while. That's easy. They're making plans, maybe with a counselor or somebody, to quit heroin. So they've already decided to do it, but they just need a good plan. Not interested in cutting back on alcohol use. They have started to carry sterile syringes to prevent the spread of infectious disease. Right? So these are all things, all worthy targets, but you have to decide, what are they a customer for? So how do we assess that? Well, one of our best strategies is this idea of the readiness ruler. And there's sort of like word and number based ways of using this ruler. For the word based method, you basically can ask somebody, where are you at? How ready are you to stop using heroin? They may give you, an answer of like, I don't really want to stop. That probably means they're low. On a scale of 1 to 10, they're probably, between 1 to 3. If they say something like, well, I know that it's ruining my life, but they don't really say I'm ready to stop, well, maybe they're in the middle, 5 to 7. And then if they say, yeah, I'm really sick of it, like I'm like ready to start, making some changes, or I think I'm ready for treatment. Okay, they're 8 to 10. And you can have a different response to them based on where they're at in terms of their readiness. So if they're on the lower end, if they say not ready at all, they're just like, I'm a 1 out of 10. No, I don't want, no, not ready to listen. Then all you can do is just say, okay, well, I get that. It's something big, not ready to talk about right now. I'll leave it alone. If they say anything except a 1, you actually can ask them why they didn't say a lower number. Now, I don't have time to go through the whole like motivational interviewing process here, but if you read books about it, which there's plenty, you will read about how it's important to elicit change talk. Because remember, we cannot guilt or shame somebody into accepting our view of why they should change. They need to say why they want to change. And you do this by asking questions in a very specific way. So when somebody's low on the readiness, but not 0 or 1, you say, oh, okay, so you said a 3, like, that's why didn't you say a lower number than that? And their response is, well, I didn't say lower because I know it's bad for me, and I know, that I'm suffering consequences, and I know this and that, so that's them stating reasons why they should change. And then you can validate those reasons. So it gives you the chance to engage in a little more dialogue without it being judgy or directive from you. Now, if they're in the moderate to high level, then you say, all right, how do we get you to the next number? I see that you're more than just thinking about this. You're ready to like start making some plans or doing something. How can I help you get to the next number? And then it helps them identify, what abilities do I feel short on? Where's my sense of self-efficacy? Do I feel not confident in a certain area? And can I ask you for help with that? So it helps you get more specifics on what they're ready for. So I mentioned self-efficacy. This is huge as part of the process. People need to feel that's that readiness and ability, like that people need to feel that I can do this and that what I do will have an effect. So self-efficacy maps on to these different stages because it sort of mirrors where they're at in the change process. Generally, when people are in the pre-contemplation and contemplation stage, their self-efficacy is on the lower end. They're not sure or they don't think that they can make certain changes. As you move into the preparation stage, they start saying, okay, like we've broken it into pieces. We've created smaller goals that I think are more manageable. Like maybe I can do this. And then actually the first actions that they take can have an influence on that self-efficacy. If they get some success, then that will increase their sense of self-efficacy. And then when it becomes a habit, that is where the self-efficacy is high. It's like, I've been doing this. I know I can do it. It's already had a positive effect. So how do you increase self-efficacy? How do you help people gain so that you can support the next stage? Mastery experiences are one method. Just doing anything well, and achieving the intended impact will increase a sense of self-efficacy. That's why going back to eating the whole elephant at once, you got to cut that down. Make sure that you identify a goal that seems manageable to them. And so with our person who is here, they probably gained a sense of self-efficacy and confidence from carrying Narcan. Somebody, a healthcare worker, probably introduced it to them. They talked about it. They say, hey, you can do this. Look, it's really, I can train you to use it in 60 seconds. It will save your life or save the life of someone around you. And so when they start carrying that, the next time that, let's say a caseworker or whatever sees the same individual again, they can say, I'm so proud that you're replenishing your supply or that you're using this again, or that you are carrying it at all. I'm so proud. I'm very glad. Thank you for doing that. You're taking an action to support your health and the health of others. All of a sudden, a source of positivity that I took an action, it's recognized, and it is relevant to my health. So doing anything well can build up that sense of self-efficacy through mastery. Also, observing others can be part of a sense of mastery, of self-efficacy. So that's why people love TED Talks and watching, other people who look like them achieve success. Because if you see someone who looks like you achieve an outcome that you want, you believe that you can do it too. So, it's like if you're talking about eating better, it may be easier to take advice from someone who, is in the same culture as you, eats the same foods as you. It's like you see these wellness influencers and they have this whole weird diet of like, I don't even know what half these things are. I've never eaten an acai bowl. Like, what is that? And so, and I actually have never eaten one of those. And so when the whole diet is based on things that like, I don't know what it is, then that doesn't look like me, right? And so that's why it's important, again, to have a broad range of people modeling and demonstrating successful outcomes. Diverse voice is really important here because it helps people believe I can do it too. So those are just a couple tips on boosting self-efficacy. So I did want to talk a bit about harm reduction here. Just in the interest of time, I'll define harm reduction for us. So in the past, this is what it looked like for people who use drugs. There were public health prevention efforts saying don't use drugs. And then there's treatment if you are using drugs and know you have a problem. However, up until the past 20 years, there was really no support in between. Like, what if the prevention didn't work? Didn't work for a lot of people. So they were using drugs and ended up just getting arrested, incarcerated, which has all of its own collateral effects, right? So, and that whole process of falling into this gap here makes it harder for people to actually get treatment because they're also dealing with like the economic and, you know, financial effects of being arrested and not being able to work and all this stuff to afford treatment. So what harm reduction is a way of supporting people who are using drugs and reducing the negative consequences of using drugs so that they can stay alive and be ready for treatment when they get there. So what it is that you're providing different services to people who are actively using drugs without the expectation that they stop. And you're doing it in a non-judgmental way without burying your head in the sand. You're not ignoring the harms of drug use. You're saying, hey, I'm giving this because, I'm giving you this Narcan because of the extreme risk of overdose, given what's out there right now. And I'm here for when you're ready to have other conversations about treatment. So it's that matter-of-fact, compassionate stance. People will often conflate something like this with like endorsing drug use. That is not what it is. It is keeping people alive so that they have the chance for recovery. Because we know you can't threaten or shame somebody into change. What the effects are of these types of programs is that it increases trust between service providers and people who use drugs. Makes it easier to seek support because certain programs, traditional programs, are maybe abstinence-based. And so they say, we're not ready for you unless you're ready to stop entirely. So then where does that person go? They need somewhere to go. They need accurate information. And so what the research shows actually is that overdose deaths go down to the extent that communities have more harm reduction services available and more people go into treatment. Plus, with things that I mentioned earlier, like sterile syringes, condoms, stuff like that, reduces the prevalence of infectious diseases. So it's actually benefiting society overall, not just the people who are using drugs. People often think like, oh, we're throwing money for people that are in all these problems and such. A, it's ignoring the background of what led them to that place. B, it is a benefit to us all to reduce the things like infectious disease. Here are some examples of harm reduction in practice. There's so much, and Maryland does most of this, which is great. But again, it's not uniform by county. So certain counties have access to these things, certain counties don't. This is kind of what it looks like in general still, like although, Maryland does have things like this, certainly across the country, it's more this way, that much of our services are available for people who are in this action maintenance phase. And remember my first couple slides, huge percentages of people who use drugs are not here. They're back here. They're back in the first few stages. And the number of services available is quite limited. So what we would advocate for is to bring more harm reduction type services or things that would count as like, overdose risk reduction services into the mix, because that will serve people in these initial stages and actually help them move towards the desire for action. If we gatekeep all this stuff and say, well, you don't have anything for you until you're actually ready for change, then more people are going to die. So to the extent that we offer this, we are helping more people get into treatment and reducing the burden of overdose deaths and emergency department visits and other infectious diseases on society overall. All right, so finally, I wanted to go through and offer a few tips for each stage just to help us put this into action on an individual level. The hardest one is pre-contemplation. Your goal is to get people to just think about it here, because in pre-contemplation, people don't want to think about it. So you have to be really gentle about your inquiries asking for permission, saying, hey, is it okay if I share something with you? So if you confront them, they will push back. This is where you might introduce the idea of a variety of change strategies, right? Cutting down versus quitting, initiation or modification instead of cessation. Thinking about the variety of different types of change that you could highlight to increase their interest in any form of change. One thing too is that you could take the gym approach and say, hey, I got a free membership. Why don't you just try it once? No commitment. That's a way of getting people to experiment with the idea of change, saying, oh, just try it once, see what it's like, and not as a commitment to doing it every day, but just as an information gathering exercise. Okay, what would it be like to spend one day doing this or not doing this? What do you think that would be like for you? Just as an experiment, let's see what happens. So that's an example of honoring the fact that they're not ready for change, but that they can still do something. You can experiment with ideas of change. You can experiment with different forms of change just to try to get any interest in the change process. And at the end of the day, you have to emphasize that it is their choice. Whenever they share anything about why they might want to change, you really want to validate that. But hold your horses. They're not ready to jump into plans because there's been no decision here. This is just, consider the benefits, to maybe even be interested in the pro-con discussion, do some experimentation with change, no commitment. Just say, what would it be like? And remember to be there for them. Once they're ready to start talking about something, this is basically a pro-con list. So when you're in the contemplation phase, you need to, again, understand that there's no commitment. So just because they're talking about change doesn't mean they're ready for it. It's your job to be that unbiased, but well-informed helper to help them go through the arguments for change, costs and benefits. They need to make the assessment of costs and benefit. And part of that can be done, and one thing I like to do is assess their value. So, how does change help you be the person you want to be? That can be really powerful. What are your values as a person? And are you living those values right now? And how could any steps towards change, get you to a more aligned lifestyle with your own values, not mine? So people will only move into the preparation phase when they've decided that the pros outweigh the cons and that the current behavior is actually too problematic to continue. So you cannot start talking about plans until they said, yeah, okay, I think I'm ready for that. When you are planning for change, you want to lean back on kind of our SMART goals to make sure that it's achievable for the person. And again, you cannot do it for them. Make sure it is a plan that they feel they can execute. Part of the plan should involve ahead of time assessing barriers and a plan for overcoming those barriers. Expect failure. Failure is a given, and it's not the end of the world. That should be part of the plan. And then finally, we get to action. At this phase, this can be very scary for people. When they make the initial changes, that can blow up their life in a certain way. And so that should be addressed in the preparation phase, but also making sure that you're able to support this person during those first 3 to 6 months of a new behavior, especially when it comes to, like, changing your substance use. It's going to be very difficult. And so they need support to, for example, check in about difficulties, help revise the plan, and use summaries to help reflect their experiences. Like, hey, you're doing it. This is, you've already done this for a couple weeks now. How are you feeling? Do we need to make any changes? Bringing that positive attitude, and recognizing that it's going to be, this is one of the most difficult phases. It's the first steps of action. New barriers may pop up that you didn't anticipate. Hopefully you anticipated transportation as a barrier when it comes to healthcare, but new barriers may come up, and so you'll have to be nimble to respond to them. And then finally, maintenance. One of the big things about maintenance is basically helping identify relapse triggers and make sure to plan for those. Because let's say they've developed a habit over 6 months. Well, that 6 months didn't include the anniversary of somebody's death or a holiday that they find particularly difficult. So you're gonna have to plan for things like that, relapse triggers that may derail their progress. One of the reasons why people do go through relapse is, it's natural to experience cravings and everything like that too, but sometimes people even test control. They'll say, oh, I want to go back to the environment. I miss my friends. I want to go back to the environment that I used to have, and I'm better now. I'm in control now, so I'm going to go test that out. You're going to want to have a serious conversation about that for somebody in the maintenance phase to think about. Look at all the work you've done. Do you really need to test control in this way? And again, relapse should not be seen as like this word that's only associated with substance use disorders either, because it happens for other behaviors that are not as stigmatized. So these are all things, this is a really old picture, but it holds true. The rate of relapse is the same for these other things. People not following their eating plan, for things like diabetes and hypertension. People not following their treatment plan for things like asthma. There is a level of personal responsibility for these other diseases that we don't stigmatize, and yet we do stigmatize addiction. And so that is something I really wanted to highlight. Okay, well, I realize we're at the end of time. There was a couple slides I didn't necessarily get to, but I want to again just leave a minute or so for questions. I know we're at 12:30. I have a couple evaluations. One is for me. The other one is the post-test from the Department of Health. I know it's a lot of surveys, but I appreciate you at least trying to fill them out. But yeah, I have time for questions if people want to ask anything. Sorry for not getting through absolutely everything.
Hi, Dr. Chan. Thank you so much for doing this presentation. I just have some quick things, and one of the things I wanted to ask was, and again, you might not have time to answer all this now, so if you can always put resources in the chat or send us something, but one of the things that I am kind of working with someone that I love about this is the self-loathing that occurs when a relapse happens,
Ooh,
and
yeah.
then they get into a place that makes it harder than to go back to the changing the behavior. I don't know if you
Yes.
have any thoughts or tools around that.
I would just show them this picture.
Okay.
It's all part of like the first few stages. Like someone who experiences a really intense self-loathing after a relapse perhaps did not internalize some of the stuff during the like preparation phase of like,
Yeah.
you know, it is true that failure is a given. It is true that people find winding paths to recovery and other goals, you know, and so that is something that is part of preparation, right? Because you're coming up with plans and planning for barriers. The fact that you're planning for barriers means that you expect bumps. And so really having them internalize that and say, this is so normal. This is so normal. You're not
Yeah.
weird for going through this. Yeah.
Yeah. Thank you. And then the other quick thing is, so you mentioned about, seeing people like you going through this,
Mm-hmm.
and succeeding at making change. And I'm really also struggling to find resources. My niece, she's in Pennsylvania, it has said that she feels like she would be open to peer support, but I'm
Yeah.
having a real hard time like finding the resources. And she's just turned 21 and
Mm-hmm.
she's on house arrest, and I would love to find somebody who could really speak to that for her, but I just don't, I'm just really struggling to find the peer support that's within her kind of age range and maybe even similar type experience. I don't know if you know anything about out of
Yeah,
state.
it may, I don't know as much about Pennsylvania, but you know, most states certify peer recovery specialists and they're employed in a variety of settings. And so, and there are often peer like associations, you know, for example,
Right,
we have, in the past in Maryland, we've had, like not in the past, like they're still around, but like Maryland Coalition of Families and organizations like that, where, that's at the family level. Even like
yeah,
peer-to-peer groups like NAMI, that's not necessarily targeting substance use, but there are like associations that may be at the state level. And so I might actually, I might call like the Department of Health where she's at to see if
okay,
they know about peer groups in the area.
all right, thank you so much, I
Mhm.
appreciate it.
Okay. Well, feel free to contact me, anyone here, if you want more information or any of the other presentations I mentioned. Um, I appreciate the chance to be in front of everyone and share this information. And there's definitely longer versions of this talk, if you want to learn more. So thanks everyone for your time, and I hope you all have a good rest of your day.
Yes, thank you so much, Alex. Very valuable information that a lot that can be applied to many facets of our lives. So we appreciate you. We may have to have you back so we can do a longer version of this presentation. But we thank you for coming here today. And we will put Alex's information in the chat if you have additional questions for him. You will receive an email with a link to the presentation and survey so we can continue to bring different topics and improve these webinars for you. We hope you join us next month, July 17th, with Thrive Emerge presenting on transitional steps for high school students, and that registration will be open soon. For our educators, we have an in-person event celebrating teachers with play and presence, a workshop on mindfulness and playfulness, June 30th in Bowie. We hope you join us. Registration is now open. And for any champions here today, I have a special request. Your feedback is so valuable to us as we begin planning for next year. So we hope you take a moment to complete the end of year campaign survey. And just thank you again. We continue to look forward to continue working with all of you with our Maryland families and children. Thank you so much. Enjoy your long holiday weekend. And thanks again, Alex.
My pleasure.
Thank you so much. This was really helpful. Really appreciate it.
Thank you.